We'll begin with the pledge. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Marty's not back here, so I'll just start. Okay, Marty, we are ready to go. Ask you to do the roll call for those present.
Mary Jo Rosmanowski.
Here.
Mary Jo Radcliffe.
Here.
Tom Epps.
Here.
Troy Webb.
Here.
Amy Huffman. Here. Ann Deemer. Here. Brad Dobbs.
Here.
Okay, thank you. And has the meeting been noticed according to open meeting law?
Yes, it has.
Thank you. Okay, before we start with public comment, in the spirit of efficiency, I've asked Dr. Severson to just present the update on COVID and the administration recommendation plan. So just so you will have that ahead of time.
So first, before we do that, I would like to share just the chart from the feedback. We sent out the survey last week. We had a fantastic response rate. Would you put up the little responses? We sorted that a couple different ways. As stated in the email, it is going, all of the narrative comments will be posted and available for anyone that would like to read through them. But right now, for efficiencies, I collated them together. Here we go, for the board to just be able to see. So just going to walk you through briefly what this says. So total responses, it says 559. There were more. There were several people who took it a couple times, and word for word everything was the same. Some people who put their name more than once, and so I did delete those. So that's why it's slightly less than the 590. We did not just ask you yes or no. We asked for a narrative because I think so many of these topics are way more complicated than just a simple yes or no. And so used a coding process to go through all of that narrative and figure out what the intention was. And so 31% of all respondents said masks should be required for all. 5% said required for anyone that's unvaccinated. 34% said no masks, and 26% said mask wearing should be optional. 3% said whatever the district decides is going to be good with us. We have faith that you have our best interests at heart. And then 1% said maybe. So that was the total respondents and their feedback on the masking topic. And then the board had asked for it to be broken out into different categories, just for your information. So the next one was just people that clicked community or other, meaning they did not work for the district and they did not have children in the district. And again, this was on your honor survey, so people could click whatever button they wanted to, but this is the responses that we got. There was 19 community members that were not parents or staff members. 32% said masks should be required, 47% said no mask, and 21% said masks should be optional. Then staff members, there was 126, just for everyone's reference. We have right around 300 staff members, 126 took the opportunity to fill out this survey. 41% said masks should be required for all, 6% said those that are unvaccinated, 20 said no mask, and 26% optional. 5% said whatever you decide, we will go along with it, and 1% said maybe they were unsure. Then we broke out just the people that were parent and guardian, and I will say that there are some people that are in both of those votes. They are a staff member and they are a parent, so I counted their responses in both of those. So some of those people are duplicated because they certainly have viewpoints from both lenses. So from the parent guardian, 30% masks, 5% just for unvaccinated, 35% no masks, 26% said optional, 3% said we'll comply with whatever, and 1% said maybe. So just wanted you to have that background information before we move forward. Again, it wasn't a vote, it was a sharing information, right? Obviously there's a lot of interest in this topic, and so our intention was 100% to just get as much input as we could in an efficient of a manner as possible, thus the survey. So lots of great responses. Wanted to share with you what the recommendation is from the admin team and public health first, and then we are going to get to public comment. And our pure purpose for this is I want to make sure things that you're advocating against, you know right out of the gate that we're not interested in doing them, so that we don't have to argue about things that aren't even on the table. So that really is our intention in talking through this stuff first. So public health, Jackson County Public Health recommends all masking for everyone, K-12. They did not have a sunset on that. They said at this point, they recommend full masking for all vaccinated and unvaccinated individuals. That is a recommendation by Public Health. There is federal legislation right now, a federal order that states on transportation, masks must be worn, and school buses are considered public transportation. We've checked with our liability carrier, and districts all across the state are doing that. We are in jeopardy of not being covered by insurance during our bus routes if we don't require masking for the drivers and passengers on either our buses or any district vehicles. So as far as other local orders, there is nothing. There's a recommendation from Public Health, and then there is a federal order that just applies to buses, to nothing, buses and other district vehicles, just for everyone's clarity, okay? So the handout that we had available for you when you came in is the recommendation. Please see draft, draft, draft all across the top. This is the best recommendation from the team of administrators that have engaged in as much background work as we can and reading through comments and surveys and trying to make a recommendation. So first of all, we're saying when you're sick, stay home. That has not changed. The COVID symptoms, but also anytime that you have a rash, a contagious disease, all of those things, you should stay home if you are ill. What the district admin team is recommending for masking is that we use the CDC website that talks about the community spread, the link right there, you have it up, perfect. So it determines based off of your positive case rate over the week period, whether you are, would you scroll up please, whether you are high, substantial, moderate, or low. As you can see, Jackson County, like most counties in Wisconsin, is currently high. It takes some time for that to get back down from, once it reaches high, it takes a while because you need a whole week span to pass without as many positive case rate ratios. But what we are recommending is contingent on this chart. And so part of the frustration last year is that once we decided we were masking by state order, there was no guideline for when that would stop. If we were to apply these rules to last school year, by spring we would not have been masking anymore because these rules would have sunset due to the positive case rate. So we just want to clarify that. What we are recommending is that when Jackson County is red or a high rate of community transmission, we would require masking for all when indoors. When Jackson County is at a substantial, we require masking for Forest Street, Red Creek, and the middle school. The reason those age groups are singled out is because the vaccine is only available through age 12, and we would not want a school with half the people in that school being required to mask and half of them not, and so the middle school would all be lumped in with them, as 12 is somewhere in 7th grade, but not for the high school because they have been eligible for the COVID vaccination. And when Jackson County transmission rate is moderate, masking would be optional for all. And so our recommendation is to use the community transmission as a guideline for the masking requirement. We are recommending that we follow the federal order because we don't want to leave all of our bus routes without liability insurance. That would be an incredible liability for the district. So we are recommending that. We are talking about social distancing wherever possible. We're not going to be cohorting the students. They will be outside with their full grade level again as they were prior to last school year. We are really trying to make the year look as typical as it can prior to last school year using the CDC community transmission rate for our guidelines. When it comes to quarantine, we would follow the flow chart from Jackson County Public Health. I did share this with board members. It needs to be updated, and we talked about it. Our nurse and our admin gave some feedback that they said they were going to update it, and it has not been updated yet. And I'll share with you what our challenge is in just a minute. No, that's all right.
I'd have to flip it.
I'm going to make it smaller to start. I'm going to let you flip then. Okay. board members have it in front of them. I'm sure the others do not. I'm sorry about that. I don't know if you can figure out how to flip that. So the important piece that is significantly different this year from last year is that if two students are are at least 3 feet apart, instead of the 6 feet we talked about so much last year, if they're at least 3 feet apart, and one of them tests positive, and both that positive student and the other student were both masked, that student is not considered close contact that needs to quarantine. So they have changed the recommendations that instead of a 6-foot bubble, if you're inside that 6-foot bubble, you are quarantined. Now they're saying if it's a 3-foot bubble, and if you are appropriately masked, you do not need to be considered a close contact. I should have started the whole conversation from every single one of our discussions as an admin team was, we want to do absolutely everything possible to keep as many kids physically in the building as possible. We do not want to have to do the whole virtual. We do not want kids at home. We want them in school as much as possible. If they are masked, then fewer people have to get sent home during the close contact piece. And if somebody is fully vaccinated, they are a close contact, but they do not need to quarantine. So if somebody is fully vaccinated and they are a close contact to a positive individual, they're deemed a close contact. However, they do not need to quarantine. Public health recommends that they wear a face covering for 14 days or until a negative COVID test. So those are the changes to the protocol. What we need them to update is it says this person is not a close contact, and that's not factual. They are a close contact. There's just no need to quarantine. So that needs to be updated. Cleaning and ventilation, we would maintain the efforts that we did last year. Personal hygiene, we heard from many people that the increase in hand washing really reduced the amount of colds that kids brought home, so we will certainly try to continue that personal hygiene. Pauses to in-person learning, we are really hoping that does not happen. We have a very high rate of staff vaccinations, which means they would not be sent home to quarantine, which is a positive because that would mean that was really a large factor in why we had to go all virtual last year. We simply had too many staff that were out of the building on quarantine, and we could not manage the students in front of us. We would continue with our contact tracing. Distance learning, if a student is quarantined, we've got a process in place where they would have access to the instruction. All of the materials would be loaded into either Canvas or Google Classroom, and the lesson would be recorded and put into that platform as well, and the students would have access to it. We're recommending that our extra and co-curricular activities happen according with WIAA guidelines and recommendations. And communication with families, we linked the dashboard updated for cases. When we read through the comments, we saw some people really wish they were still getting a phone call every time there was a positive case. Others say, please stop calling me, I don't care. We have resulted back to the dashboard, and this is accurate as of today. The other pieces that I want to talk about, testing. We are not recommending testing in our schools. We are not interested in taking that on top of all of the other tasks that we have in front of us. We are not interested in testing, and that is a choice we get to make. In our Jackson County Public Health Zoom, one of the other districts that is more remote said that they are going to offer, so let's say a child is exhibiting symptoms, they will call that parent and say, your child has a fever, they're coughing, I need you to come pick them up. The parent says, okay, I'll come get them. The school will say, if you're interested, we're willing to test them for you as a service. If you're not interested, then fine, you can go get a test elsewhere, or you can be quarantined for the 14 days. We don't care, but we're offering this as a service. We are not interested in mandating testing because we are a little bit more centrally located with other healthcare providers. I'm not sure that that's a service that's as important for us to provide as one of our more rural neighbors who they could have to drive an hour in order to find a testing site. The other piece is vaccination. We are not requiring anyone to be vaccinated. We are not providing any vaccines without parental permission. We have a long history of a partnership with Jackson County Public Health in which we offer our school buildings as vaccination clinics. This happens annually for flu shots. It happens for when the booster shots are needed. So we are not requiring vaccination of anyone. When vaccination will matter to us is if you are deemed a close contact. If you are vaccinated, you do not need to quarantine. So we are not requiring it for anyone. So I just want to be very clear before people share their thoughts that we are not advocating to do any of those things. It is, we would, some of the comments suggested that we would vaccinate kids without their parents knowing. Oh my Lord, I hope we have built a little bit more trust in our community than that, because we absolutely would never do that. That is a parental relationship with the healthcare provider. We're just providing the space if people are interested.
Presumably, if a student is 18, though, they get to make that choice.
They get to make that choice if they're 18, correct? Okay, so I just wanted to get that recommendation and as thorough of that as possible. And I'm assuming the board is going to wait till we get to that piece before we have our more robust conversation, and you would be open for public comment at this time?
Yes, yes.
Perfect.
It's time for public comment, and just review the rule that it is a 4-minute limit. And Marty will call the people out according to the list now. Thank you.
So the first person that signed up is Robin Huffman, and her topic is vaccines.
Oh no, Robin's here. I'm sorry, Nicole. I was asking.
Hi.
This. I'm sorry. Yep. Sorry, Nicole.
They got
Miscommunication.
TV in the other room, there's too many people.
Yeah.
Yeah.
We asked. Thank you. I was going to ask for the microphone so that we can make sure the recording picks it up.
Okay, hello. My name is Robin Huffman, and I grew up in Black River. I graduated from here. Have since resided in the area, and I'm also a parent. And I'd like to give a sincere thank you to the board members for your devotion and time to the school district and community. I can only imagine that this is a very challenging time to be a board member, so again, thank you. I would like to ask if there's ever been a time in history that we can remember when a vaccine has been pushed on the people with bribes of money, gift cards, food, etc., coercion, threats, violence, and force, not only in the U.S. but all over the world. We may want to ask ourselves this. The survival rate for COVID-19 is over 99% for children. We may want to ask ourselves why an experimental, unapproved shot is being mandated all over the world. According to the experts that have never treated a COVID patient, this is all being done to save lives. When people have a right to choose freely for themselves and decide that for their family the risks outweigh the benefits, now they may have to fear losing their jobs, incomes, homes, and cannot buy food for their families. And at what cost are they saving lives? Soon the shot will be approved by the FDA, and the fact remains that we the people, I believe, are the experiment, and we have no idea what the long-term effects of this shot will do. I would like to raise some important points that Dr. Ryan Cole addressed recently at a White Coat Summit meeting this month. He had numerous concerns about the COVID-19 shot. Dr. Cole, who specializes in pathology, has indicated that they are seeing a 200 times increase in our society with heart issues after receiving the shot. After the COVID shot, children are now being diagnosed with myocarditis, which is inflammation of the heart. He states that once the heart cells are damaged, they do not make new heart cells, but rather scar tissue. This damage is forever and cannot be reversed. In addition, he stated that the spike protein that is in the COVID shots is inducing the same disease COVID-19 induced. He stated that the spike protein is a toxin to our bodies and is causing inflammation to multiple organs of the body, such as the brain, lungs, heart, liver, testes, ovaries, kidney, to name a few. Dr. Cole also indicated that the COVID shot is an experiment on humanity. Dr. Cole is one example, although there are numerous doctors, scientists, and statistics that would speak contrary to what we are being told by our politicians, elites, and the media. I believe 1 Corinthians chapter 6, verses 19 through 20 may shed some light on how God may see this vaccine. Or do you not know that your body is a temple of the Holy Spirit within you, whom you have from God? You are not your own, for you were bought with a price, so glorify God in your body. And 1 Corinthians chapter 3, verses 16 through 17. Do you know what you are, God's temple, and that God's Spirit dwells in you? If anyone destroys God's temple, God will destroy him, for God's temple is holy, and you are that temple. My point is, this past year and a half, there is only one thing that makes sense to me, and that God is in control, not our government. They have taken God out of the equation long ago, and that is extremely evident in what is happening in our country and around the world. And unfortunately, that is to our detriment. Please take into consideration all ramifications of encouraging these shots for our children. And in closing, there are a couple more scriptures that may inspire one to seek his direction because he is our only hope, not our government. Psalms chapter 118 verses 8 through 9. It is better to take refuge
Robin, you have 30 seconds.
in the Lord than to trust in man. It is better to take refuge in the Lord than to trust in princes. And lastly, Proverbs chapter 3 verses 5 through 6. Trust in the Lord with all your heart and do not lean on your own understanding. In all your ways acknowledge him, and he will make straight your paths. Thank you.
Thank you.
Barb Settlebauer?
Yeah, thank you. Barb Settlebauer, taxpayer. And you guys are really all in a hot seat right now. I am so glad to hear that you are not going to mandate vaccines. But will that change if the federal government mandates, being this district receives funds from the federal government? Are you prepared for that? I had other things to talk about, but I did send you a letter that 38 parent groups from Wisconsin sent to the acting president, Joe Biden, and Governor Evans. I hope you had a chance to read that. But you need to be prepared. Be prepared, because it may happen. It might not, it may not, or it may. So I'm glad to hear that. And I'm for choice of masks. Whether they want to wear a mask, fine. If they don't, fine. So thank you.
Thank you. Just want to remind people, you can trust that the board does review information prior to the meeting. We have a large packet and everything that is sent to the board is reviewed. So thank you for acknowledging that and limiting your talk there, Barb. Okay, next.
Candace Johnson. It doesn't say what she wants to speak about.
Hello, my name is Candace Johnson. I'm from Hickston. I have 3 children in the public school system. And you talked quite a bit about what I was concerned about vaccines in schools. That was one of the biggest fears that I had. And another concern that I had was incentives on vaccines, trying to give incentives to children and put it in their children's heads. If you go get this, we'll give you this. I don't think that's right at all. You're pushing your agenda on the children to get them vaccinated. And I really don't think that should be on campus at all. That was a really, really big one for me. And masking, I think it should be optional. It should, I mean, would you want to wear a mask all day long? And a lot of these school systems don't have proper ventilation, and your kids are just sweating and sweating all day long. And I just don't want that for my kids. So the vaccines and being pushed on our children, and the masking was a big for me.
Thank you.
Candace, I will just share that we have had some outbreak on some of our high school athletic teams, and some of the students noticed that some kids on the team had to get quarantined and some did not. And when they asked why, we said because they are fully vaccinated, so they don't have to quarantine. And some of those kids went to their parents and said, can we talk about this vaccine? I don't want to have to be quarantined. So that was not us incentivizing, other than the exclusion protocol that says if you are vaccinated, you don't have to quarantine. So I just want to be very, we are not trying to dangle any carrot, we're just providing this space, but I wanted you to know that.
Because just on the flyer, it said incentive, there was another on top of that, which I really don't understand why. If someone is vaccinated, it hasn't been proven, then they're not spreading it as well. So why wouldn't they have to be able to quarantine too?
And that's the new, the new CDC guideline is that they mask because they do still shed the virus if they've been vaccinated.
Okay, thank you. Next, Marty.
Carrie Swigum.
Good evening. First of all, I'd like to thank Tom and Amy for taking the time to watch and respond to the email link that I sent earlier last week. My name is Carrie Swigum. I have 2 children attending the Black River Falls High School for the 2021-22 school year, one of which is a senior. I'm here tonight to address the pending mask mandate. There have now been many clinical studies along with simple science telling us that this virus is spread by aerosol droplets. Droplets too small to be withheld by the mask. The mask that we ask our children to wear will not prevent the spread of this virus. We also now know through lab testing that harmful bacteria, parasites, fungi, dangerous pathogenic, and pneumonia-causing bacteria are captured in these masks and serve as a breeding ground. Some of the found are pneumonia, tuberculosis, meningitis, sepsis, keratitis, encephalitis, antibiotic-resistant UTIs, diphtheria, and Legionnaire's disease. Then there's the issue of increased depression, disassociation, feelings of isolation, and the emotional effects masks have. Learning becomes difficult because students are not able to discern facial cues, not being able to clearly hear the instructions given, or even mispronounced words. The students need oxygen for their brains to properly work. Any neurologist will back this up. It has been proven that oxygen intake has been hampered by the wearing of masks, let alone the ridiculous suggestion to wear multiple ones. Then this leads to proper fitting of the mask. Are we to believe that OSHA will be on site daily to ensure the proper fit and cleanliness of the mask? Surgical masks state that they are only effective for 20 minutes in a sterile setting. How many of these masks get changed out this often? Can we rely on the schools to properly observe that this will happen? I think that would be asking a lot of our teachers. No matter your feelings on the mask, we have to remember that the CDC, the DPI, and the governor can only suggest to wear the mask. They do not hold the position to make this the law. To that extent, I would like to address all of you on the board. You are a board of education, not health. We elected you to ensure that our children are being properly taught an acceptable curriculum. We asked you to look at what our teachers are teaching and making sure the students are getting the advantage in learning that this district prides itself on. In closing, I have some books to aid you in your decision making on whether or not you go forward with a suggestion for students to wear masks. First, the Constitution of the United States of America. Second, the Declaration of Independence.
30 seconds.
The Bill of Rights and the Federalist Papers. And finally, the Holy Bible. This will show you that you have no authority to mandate masks and prove that our children have guaranteed freedoms and God-given rights to breathe oxygen freely without the mask. I sincerely thank all of you for your time and your consideration on this matter going forward. Thank you.
Betsy Settlebauer.
Ross is gonna hand you something out. I just got back from work and got it done, so sorry for not emailing you. I know you guys like looking up links, so there's a lot of links. So my name is Betsy Settlebauer. I'm a parent, I'm a taxpayer, living in Kingston. Tonight I'm asking you to return the health care back to the parents and your staff and let masks be optional on school grounds and on school buses during all colors of Jackson County. The CDC has flip-flopped on vaccine, social distancing, masks more times than covered split burgers this last year. Social distancing went from 6 feet to 3 feet. Why? There was no evidence on that. Vaccines, only to the high risk at first, then absolutely no one under the age of 18 was this last spring. All of a sudden there's a push to get 12 on up, and now there's going to be a push even to get babies on up. Even though this vaccine in the last 8 months has over 500,000 adverse side effects, over 9,000 deaths from this vaccine, according to our own government reporting system. It's a virus that's 99.997% survivable. The CDC has also changed the definition of herd immunity. Why? The The CDC is not a law-abiding branch of government, they give recommendations. The DPI is not a law-forming branch either, but will put financial strings attached to try to get school districts to do its bidding. Hopefully our school district does not fall under this. In June, you all had masks on. In July, you decided to make masks optional. Not one person, even those with masks currently on, had masks on in July. Why? Because that you base your decision on what was best for you, to wear or not to wear. At the all-staff breakfast this morning, how many wore masks? I bet you it was close to hardly any at all. To mask or not to mask should be up to the parents and the staff, no matter what colors Jackson County is under. Just as you have the freedom to make your choice. The same for buses. There is no law stating that the masks need to be worn on school buses or public transportation. Congress didn't get together and pass any law, and President Biden did not sign any law. It's an order, it's not a law. In fact, there are many lawsuits on that, and hopefully some will be heard soon, and you guys can change it. Insurances should not have to blackmail you in order to have that policy. These are all recommendations. What if the CDC says, hey, you know what? Any child from 0 to 14 years old should have a football helmet on at all times during school, because there are over 775,000 ER visits with head injuries. Hopefully you guys just say, wait a second, that's kind of off the wall. But would you mandate it if they recommended it? The CDC gives recommendations. School board members, you choose to wear or not to wear your mask tonight, and the same with principals and teachers here. Your job is strictly to educate our kids, not be the health enforcer of your staff and students. Leave their health care up to them, the staff, and to the parents of what's best for their kids. Remember, it's my body, my choice.
Thank you.
Jeff Polzine.
Hi, I'm Jeff Polzade. I want to thank the board for letting me come and speak tonight, and I would like to say that the district's done an excellent job in meeting. There's a listing currently of CDC requirements for K-12 schools, and the only item really that hasn't been finally decided on is the one we're discussing tonight. They've put in new ventilation, 2 of the schools, which is very important. They've done a lot of work doing their best job on that. I would also like to say that Jean Crone and I have got to read over the draft tonight. We both feel that it's a real reasonable plan, and so our comments would be in support of that plan. I went to Mayo Med School, went to the Mayo Family Practice residency, and then I worked here for 36 years. I kind of helped teach students from both Mayo and Madison medical schools, and some MCAL students from Milwaukee. Gene started the program, and then I became his assistant when he retired. Then I went on teaching. So I'd like to start with, do masks work for COVID? And I'd say let's look at Australia, where aggressive mask wearing and contact tracing and quarantine have been used throughout the pandemic, compared to Wisconsin, where mask use, quarantine have often been refused by residents. Good contact tracing is impossible when case numbers are high, so that really hasn't been possible in Wisconsin, but they work hard on it in Australia. Australia has 25 million people. They have had a total of 40,000 COVID cases. They have had 900 COVID deaths for 25 million people. Wisconsin, and those are just in the last week off the internet. Wisconsin has 5 million people. That's 1/5 as many people as Australia. We have had 750,000 COVID cases. That's 90 times more per capita than Australia. We have had 8,300 COVID deaths. That's 40 times more per capita than Australia. The main difference, I think, between those two countries is the aggressive mask wearing, and then in turn, because their case numbers are low, they can follow contacts. They're behind us in vaccination, but that's not because they're not trying. They're currently having to take some vaccine from China. When they can get it, they prefer the Pfizer vaccine. Currently, do masks, another question that's come up quite often is, do masks weaken our immune system? Well, how do you judge a weakened immune system? It's not easy. That's still being researched, ways to test that. but let's use sick days and length of life. And let's look at ear, nose, and throat surgeons, ENT. They were masked perhaps half of their professional hours through a 25 or 30-year career. That specialty, ENT, has the longest lifespan of any medical specialty. And they and most surgeons almost never take a sick day. I talked to Dean too. We can't remember a visiting ENT who's ever missed a consult day. And we can scarcely remember our surgeons who we've had taking a sick day. And they're in masks, equal numbers to ENT. I would like to say if masks at school were optional and case rates are very high, I would keep my children home. I would encourage our grandchildren to stay home.
30 seconds.
Okay, over 96% of MDs have taken the vaccine. I and most of my colleagues would choose to have it for our children and grandchildren. A review of vaccine side effects shows that all the side effects that have ever been seen for all the vaccines show up in the first 2 months. Very unlikely that new side effects will show up down the line. I would encourage people to talk to their doctor about getting the vaccine, talk to their personal MD, see what they think. Okay.
Thank you, Doctor.
Thank you.
Jean Crone?
I'm Gene Crone. I'm a retired physician from the Crone Clinic. I've lived here all my life. Went to school at the university for my medical degree. Really, I don't have very much to say, I don't think, because I came here wanting to encourage the board to follow the CDC guidelines, which you're obviously doing, and I certainly agree with your plan. I think that this virus hasn't been mentioned here, but it's much more infectious than the prior strains, this variant. So all the more reason to be really careful with our kids. A couple have said that you're only responsible for the kids learning. I think you're responsible for their safety while they're in school. So you certainly have a right to be involved with it. Only one thing that I kind of wondered about was the substantial rating under the high rating. Is it that people eligible for immunizations don't need the mask?
So the recommendation that CDC put forth, the colors don't have anything to do with vaccination rate, only positive case rate. The recommendation from CDC is that if you're fully vaccinated, you don't have to quarantine, but they recommend you wear a face covering for 14 days if they're not mandated for everyone. So like if we were down in the yellow and face coverings were optional and a staff member was vaccinated in a close contact, we would ask them to wear a face covering during that time. Yeah.
A couple things that I was going to mention about I haven't heard any evidence that anybody's contracted any of these diseases that were mentioned, pneumonia, various other diseases from the mask. They seem to be safe. And my grandkids wore them all last year, and they got along quite well with them. So I think that kids adjust to them and do well with them. A couple of things that interested me. This week there was a report out from Duke University on masks. They checked masks by having people breathe through a laser beam and then photographed the droplets that came. And they showed that the masks these two masks I have both are way in the 90% of preventing droplets. Somebody said that they don't prevent the small droplets, but they're So a lot of the disease is also transmitted by big droplets. It doesn't have to be small droplets. So I think, I think the mass from that study were very impressive. And the last thing something that astounded me, I stole them, sorry for the belief, but influenza rate in 2019 and 2020, that season, there were about 38 million cases in this country. And the next year, when masking was widely used to the flu season,
30 seconds left, 15.
there were 2,038 cases of influenza diagnosed. It's just amazing, but that's a CDC statistic, which the CDC isn't real popular, I guess. But that's all I have. Thank you. Thanks for having me. Thanks for allowing me to speak.
Thank you.
Annette Kruger. She's not in the room.
Yes. How many more do we have on the list, Marty?
5, including Annette.
Okay. Is the board interested in extending our 30 minutes to keep, it would be another 15 minutes or so? Okay, thank you.
Hello from the overflow room. I am Annette Kruger. I'm a parent and a grandparent, and I do not currently have anybody at school at this time. Most of the things I was going to say have already been, all the facts I had written down have already been said. We have been in this pandemic for 1.5 years or more than that. Look where we are. Look where we are. I don't think we're any better off this school year than we were last school year. And in fact, I think it's more dangerous this school year because we've been wearing masks and things for over a year now, and more people are tired of wearing masks. So I think it's a more dangerous situation. I'm worried about the young. I'm worried about the under 12 years of age that cannot get vaccinated. I have a 4-month-old grandson, and I am terrified to death. There, some other things. Some of the hospitals in the southern states are full, whether they're Texas, Florida, Louisiana, other states also. That could happen here with this dangerous Delta variant that we are in right now. A doctor said that everyone who is unvaccinated will catch COVID at some time and place. Sometime and place, you will catch COVID. This isn't going to be over in years. We're a world economy, and people travel everywhere, and they're going to bring it back here. And so that's something to think about. Let's see, I guess I don't really understand why some people are angry over wearing a mask. Don't be the reason that the schools are disrupted. And let's see. Also, the way the Delta variant is going, you're gonna need proof of vaccination or else a negative test to enter many places. Ball games, concerts, restaurants, airplanes, travel, all sorts of things. And I guess the last thing I have to say is that the longer this pandemic goes on, we'll probably have another variant that is worse than the Delta variant, more contagious and more deadly. So I guess think it over and, do what you have to do, but wear a mask and get vaccinated. I can't remember if I said this, but it's a pandemic of the unvaccinated. The most people that are dying are the unvaccinated. That should be enough right there. I mean, what else needs to be said? That's all.
Thank you.
Sarah Peliquin, and I believe she's in the other room.
I'm actually reading a letter from a parent who wasn't able to be here, so. But I did want to ask, you didn't say anything about vaccinated or people who have already had COVID, and do they have to wear masks? Do they have to get vaccinated? That was something that didn't come up, and I would be interested to hear an answer on that one. Anyway, who raises our children? Who conceives, births, and feeds our children? From the moment they're born to the day they leave on their own adventures, our children are a part of us, and we all want what is best for them in every way. There are a lot of different organizations and public services to help our children find their path. Extended family and friends, organizational clubs, churches, policemen, firefighters, doctors, nurses, and public education are all part of our children's lives. As parents, we know what's best for our children, and we know when something is not right. Anyone who harms our children, intentionally or not, brings out a parental instinct that is not shaken by threats or intimidation. Parents have the right to make sure their child is protected at every opportunity. This right is not given to anyone else and is solely reserved for the parents. When a child gets sick, we take them to the doctor and listen to the doctor's advice. If a child suffers trauma, we take them to a therapist and listen to their advice. When a teacher says your child was struggling in school, we listen to the teacher's advice. When there was an airborne illness that had potential to harm our children, parents listened. We gave up our time and careers for our children. Parents have now learned from experience. They're able to choose what is best for their kids. Some parents know their children are being harmed, not from the illness itself, but from the conditioning of fear in our children. Masking children is creating deficiencies in learning, coping, and immunity. Experts are hopeful that there will be no long-term effects of constant masking, but this alone is not assuring. Parents know their child, they raise them and learn more daily about their needs and desires. School is just one part of a child's life. It is just a slice of their day. It's a special part indeed, but it does not define them. School should not be about conformity or seclusion. It should be about new ideas and concepts for them to learn and to explore the curriculum that is offered and approved by the community. Our children are ours to protect. The school's job is to educate our children with the basics of academics so that they may thrive. Our family doctor's job is to make sure our children stay healthy, and in doing so, they communicate with both the parents and the children. The final say is always with the parents. Please do not try to threaten or intimidate our children to do something that parents aren't comfortable with. Giving parents the opportunity to protect their children as they see fit is not only right, it is also recognized by law. The school's ability to teach my children is at my discretion. I do not relinquish all control to the school district. If fear guides your decisions, what does that say about your votes? Fear dictates over experience. The unknown is unsafe and ambitious ideas should be discarded or maybe even outlawed. If science guides your decision, what does that say? Science knows all? That all science is proven without challenge? Asking a question is anti-scientific? Science is never a constant. It's an evolving understanding of our world and its relationship to us. It is not absolute and it is always refutable. The very nature of science is to question everything. To be absolute in scientific belief without question is irresponsible and lacks a true understanding of theory and experimentation. Data is fraudulent if not treated with suspicion. Critical thinking is key to asking the right questions and finding possible conclusions for yourself. Speaking of experts, as a parent, we are the experts in raising our children. If economic loss guides your decision, then you're not putting students first. The primary function of a school district is to educate the children and help them thrive. Everything else is ancillary. A successful outcome is a student who accepts challenges, thinks clearly about their choices, and is prepared as can be when they graduate. Physical challenges are not to be dismissed, but they cannot be a factor when it comes to usurping parental rights. I am a parent. I raise my children. I want the best for my child and care deeply about the welfare of all the children in our district, state, and country. Every parent here tonight is here because they know what is best for their family. They choose board members to represent them. They want local input, not a committee from across the state or country. I understand the position that COVID has put us in is is trying and stressful. All the inconsistent and often biased information has taken its toll and caused more chaos in the last 18 months than most of us have ever thought possible. We don't take our concerns lightly and hope that none of you do either. We know you want the best for our children, so please let parents decide for their own children and make masks optional for 21-22 school year. Thank you.
Thank you, Sarah.
Tom Walker.
roll.
Hello, everyone. Thank you for extending the time for public comment. I really appreciate it. My name is Matt Carls, Hickston resident and father of two. I just got a few minutes that I want to share with you some of my ideas that are in regards to masking. Masking should remain optional. One thing I've learned in the last 18 months of this pandemic is that the CDC, the Wisconsin State and County Health Departments' wishes should not be superseding the parental rights when it comes to masking our children. Please do not go down the path following the CDC's recommendations. They don't make sense. Those health departments exist for guidance and guidance based on science, not to push unlawful mandates unfounded in science. We know that COVID is more lethal to the elder population and those with pre-existing conditions, including those who are obese, which is accounting for about 85% of all COVID deaths. If we give a little more attention to our weight management and education for obesity, we would take good care of problems. By forcing children to wear masks, you end up doing more harm than good. The reasoning that children under the age of 12 need to wear masks because they're not eligible for the vaccine has no scientific standing. Any adult that has had ample of time to get the vaccine by now, they're free and available everywhere. The vaccinated population is still contracting and spreading the virus. This is known. In fact, this is how similar COVID is to the flu. People take the flu shot every season if they choose, to reduce the risk of hospitalization and death, not to eradicate flu altogether. COVID will be around for some years to come. Let's realize that the chance of our children dying from COVID is near 0%. However, the chance of children's psychological and physical health of being negatively affected is happening and will happen more if you enforce mask mandates. Last school year, my kindergarten daughter got sick several times throughout the school year, not from COVID, but from the common cold. And oftentimes coming home from the school bus after a long 8-hour day of wearing a mask, her mask was disgusting. We don't need a microscope to see that that's not healthy to breathe in all day. These masks are not designed for and capable of stopping COVID. That's a fact. The bacterial growth and inhalation of these contaminated masks is not healthy. We need children to be allowed to interact with their peers with full facial communication, no masks, and build a strong immune system to live long lives. I also have a 4K son will be going into 4K if you do not require a mask. I say if you do not require a mask because he will not go to school because he's got a speech delay and needs to see people's mouths to learn how to speak. This last year and a half, he's been set back on his development. Other students who might not have special needs are still special. Every student's special. They're fragile, and there are critical points in their lives where they deserve the best possible opportunity to interact with another without a mask. They deserve the truth. Our children's development and education are much more important than masking them. There are many reasons that masks should not be enforced upon our children, and not one study that proves masking has stopped or slowed the spread of COVID. The inconsistencies in giving people a false sense of security by wearing this mask is irresponsible of not only parents who allow this situation, and that's why you're seeing more of a stand up. If the board votes to make masks mandated again, you'll be sure that you'll lose some more enrollment, and it's not something that we want to do. We want to be able to send our kids to public school and enjoy the community, but I just really caution you to just resist the CDC and the state's guidelines on this masking topic, and just think about everybody in the community. Thank you.
Thank you.
Heather Green. Oh.
Hi, good evening, everybody. Thank you for your time. I just wanted to discuss a little bit about what you guys are conversing about, and whatever you guys decide, just decide for our children. Some of us just go with the flow, but also I would like to bring it up that some of the children that are in the school district are special needs. Some of them don't have the capability of doing virtual. Some of them have to be in school. My daughter is going into 6th grade and she is currently going blind. We've known this since she was 4 years old. Every year she's had an IEP for her school. Every year I ask for Braille books for her because every child gets to go to the library and check out books. My daughter has to sit there and watch everybody check out books because she can't read what's on there. She's got very limited vision. We've been asking the school district since she was in 4K for Braille books, and we keep getting the same answer. They're on their way, they're on their way. I don't know where they're on their way from because we've never seen Braille books whatsoever. When the pandemic started and everybody was rushed home, she was one of the first ones because she was labeled special needs. She doesn't have any health issues, thank God. It's just her vision that's going. The last couple months of school when everything was shut down, she couldn't do anything because there was no materials for her to do. She can't do virtual, she can't see. So whatever you guys decide, I hope that you guys kind of are mindful of the special needs children that need these accommodations, because it feels like since the pandemic started that nobody has been accommodating these special needs children. I have a sister who also has a special needs child, and he could not go to school at all. And when we found out that he wasn't really doing anything, it was just the teachers just checking in, hey, how is he doing? You know, that kind of hits you in the heart there, and it kind of makes you some kind of way towards the school district and and whatnot. So yeah, I really hope that whatever you guys decide, you guys take into accountability of all of the children and not just the normal children, the children that don't have issues, because it seems to me like the school board has not thought of those children whatsoever. So I want to thank you guys for your time and my community members for speaking up for their children as well. Thank you.
Thank you.
That's all.
That's it, okay. Okay, thank you so much for the large amount of input that we've had tonight. And we'll continue on our meeting with gifts and grants.
Great. I was very excited to share with you. You perhaps saw the Swinging for Students, the golf outing. Brad Dobbs was very instrumental in doing that work, along with Barb Simonis and Jordan Nortman. They were inspired by the Angel Funds conversations that we've been having the last couple of years and the large amount of negative food balances that existed. While last school year the meals were free for all students, this year we again are enrolled in a program in which there will be no charge for meals this coming school year either. I just want to be clear that was a program we opted into, not something that is everywhere, because there are some districts who did not opt in, and so I just want to be clear that people don't think it is everywhere. Our negative lunch balances have taken a significant improvement. They're really moving in the right direction. We had several people who donated. I recall this very clearly. Downstairs there were people that came in with their stimulus checks and just said that they wanted to donate those to kids. And so we just really have a very, very, very generous community. This threesome put together the first, I think, annual, like it's going to happen again, the first annual Swinging for Students, and they collected in that event $10,723 for that Angel Fund. That is amazing, and the impact that will have, and they really, that does deserve a round of applause. And so in talking to the three of them that were kind of the drivers of this, we talked about, no pun with the drivers in golf. Anyway, the people who were driving that we would really focus on our senior students, because while all students earn a diploma, well, hopefully all students, but when students earn a diploma, they get their diploma no matter what. We do not allow them the privilege of walking during the ceremony if they have negative lunch balances, account balances, all kinds of other things. The Angel Fund has attacked the food negative balances, but oftentimes our seniors have, if their freshman year they cracked a laptop screen, that debt is still with them their senior year, and they, at that time have a hard time coming up with it. Our school social worker, I think, does a great job of, if she knows the student has a job and they owe $150, she'll say, we'll take this 100, you are working, you take that 50, and we'll get you to be able to walk during that ceremony. So it isn't completely wiped away the debt, but it is certainly more manageable for those students. So anyway, $10,723, how fantastic, and something that will happen again in the future. So thank you so much for your work on that, Brett. Yeah. That's the fun stuff to get to talk about, right? No COVID relation there, just fun stuff for kids. I love it.
Would you like to make a motion to approve that?
Sure. I move to approve the gift to the district.
Thank you.
I second it.
Thank you. Any questions or discussion?
I don't have a question about that, but as long as you brought up lunches and that everyone is going to get free, will it be delivered the same way as last year?
We just found out today that we are going to be able to use our trays and silverware, all of that stuff, so we won't have the consumable garbage.
Plan to start the old way, right?
Okay, good. I just thought I'll sneak it in now when we're talking about lunches. So.
Okay, good. Okay, we have a motion and a second. All in favor say aye. Aye. Opposed? Okay, motion carried. Now we're on to the COVID decision making.
If only the rest of it were that simple, right?
Yeah.
So just for some background information, I shared with you what our recommendation was. I would just, if I could, respond to the comment about people who have had COVID. CDC has not changed their requirements. They do not recognize officially that if you have had COVID that you have the antibodies equal to the vaccine. That is not something that CDC talks about, and so that is certainly not in the recommendation from Jackson County Public Health, just for complete clarity. The only thing that I would add to the discussion that we've had is, of course, I still am in contact with all of our neighbors. I talk as often as possible to see what other districts are doing. The last time we checked in as a CISA, that's 26 districts in our region, from Viroqua, Westby, West Salem, Arcadia, Independence, all the way down to Loyal. I mean, there's it's far-reaching. At that time, there was nobody that was mask mandating, but that was 3 weeks ago. And honestly, 3 weeks ago, we weren't in high as a county. We weren't talking about mask mandating at that time. And so I reached out just today, and West Salem is having similar conversations to where we are. Alma Center has said that they are making a recommendation that just their K-8 wears masks because they're not eligible for the vaccine, and our other neighbors have said that they're not engaging in mask conversations at this time. So I just, full disclosure, want you to kind of get the pulse of where our neighbors are at and what conversations I'm aware of. I will say that, you know, like a month ago, we all were in lockstep, and then 3 weeks ago, another conversation, 2 weeks ago, and then just today, another email went out. What are you guys talking about today? Ironic you should ask. We're having a large public conversation about it tonight. So.
Okay, I just want to start out by saying, you know, thank you to Dr. Severson and the administration and everybody in this room and our community who's contributed to information that we've received and the development of this plan. And all it's taken a lot of time and a lot of input from getting the survey results done, and I just really appreciate all the time that you've spent on this to make sure that you have.
The whole admin team is very willing to answer any questions that you have about what it looked like last year and what changes, because again, last year we did the cohorting, we did the I'm trying to think of some of the other pieces, but lunches were very different. Honestly, with the 3 feet as opposed to 6 feet, that really changes significantly an awful lot of what we're able to do in the schools. And so if you have questions, we're very happy to talk about them. Melanie was very intentional when we were Forest Street Early Learning Center principal, when we were talking about the ability to spread out our kids, and specifically talked about our phonics program. Could the kids, when they're doing that piece, could they spread out throughout the room unmasked, so that we could clearly say, again, if we're looking at all kids being in school as much as possible, if they were unmasked and outside of 3 feet, they could do their phonics practice, put their mask back on, and then go back to their tables, and then they wouldn't have to be quarantined. And so if it's our local decision making, I think it would be responsible of us to make the decision to use teacher discretion when they're doing skills and tasks that the facial expressions matter that much, that they have the flexibility to do that. I will say that almost all of our speech and language paths wore the clear screens last year. We recognize that facial expressions matter, and articulation matters, particularly for speech and language. And so those people are already wearing clear visors, not covering that. I'm not saying it's easy, and I'll be honest, we had a lot of discussion over how much lost instructional time because we're arguing with kids over putting their mask on. We're not suggesting any of this is easy, and if we go at this from the goal of how can we keep the most number of kids in school, and we know we don't have to send them home if they're both wearing a mask, that really is what guided our decision. So again, wide open for questions from the board. Just wanted you to know this was not a quick discussion for us.
Mary Jo.
Well, one thing I noticed, I appreciated all the responses on the survey, and there's a wide range of people that want masks, don't want masks, want them optional. But one thing that I noticed in common from all the responses, they wanted school to happen. They wanted us to have kids in school. They didn't want the breaks. So what I really like about this plan that you guys have developed is that I think it will keep our kids in school. We did quite well with that last year, and what I really like is that our county is in control of how the kids are going to be masked. If we're having good behaviors in our county and we're not getting a lot of cases, kids won't have to be masked. I really like that it goes to the local county and we're not taking advice from the whole state. I do like that piece a lot.
Thank you. Anyone else?
Well, if we're talking about the county, then if districts of neighboring are not doing the masking, are they going to be closed more often? Is that what we're stating then? Because isn't it up to this district to decide that at that point?
If they close, is that up to
If
them?
they close, it's up to the
Sure.
district, yes.
For sure.
So, in other words, that makes it discretionary for the district to choose to close or not.
Absolutely.
Right, and that's where we're at. So in other words, the argument that states that if we don't mask, we'll be closed more often is actually not quite accurate because it is a discretionary choice.
To close?
To close, yes.
I'm sorry. So you're absolutely right. The district made that choice.
Yes.
I would just say that I know one neighbor for sure. They closed when they were out of staff, and that was ours too. So you say
I understand
discretion,
that
yet
too.
you get
Right,
backed
because-
in a corner where you don't feel like you have other choices.
Well, that's if we follow the protocols that are basically here that are introduced.
Yes.
That if we follow those protocols, we could end up closing the school. If we don't follow the protocols, it will be just a decision based on the administration's perception of what's going on in the school, right?
Absolutely.
That's what's going
you
on. So
always
that's-
have that. Yeah.
That's what all I'm saying is we're not mandated to do this, or not the word mandated is not correct, but or we're going to close. This is still leaves a lot of discretion for the whole choice of the whole situation. So that's all I'm asking.
Not an either or. Absolutely.
Right, exactly. It's not right.
Absolutely.
Okay, any other comments?
Yes, I do. I have a couple of different things. So obviously, when you shared the information, you shared a link for the CDC information in our county, and it is currently in a high status. So that would mean if we approve this draft, we would be going immediately into masking.
That would be up to the board to decide.
Well,
so we
I
put
said
in,
if we approve the draft.
Okay, sorry.
So yes, but and this was developed and supported by the admin, and yet very few people are masked, including the board who had all this information. So I just want to say that. And if we're going to require masks, why would we not specifically require the N95 masks? And the reason I say that is because those are the ones that are most effective. And I was looking up information today about, and this is from the EPA, United States Environmental Protection Agency. It was published on April 5th of this year, so it's very recent. They've been doing testing on the effectiveness of the different materials used in masks. Let's see, results show that N95 masks are 95% or greater, even if they're expired and have been sterilized because they've already been used. Surgical masks with ties are 71.5% filtration. Surgical masks with ear loops are 38.1%. So that's really getting down. In another study, researchers examined the filtration ability of a variety of medical procedure masks, cloth masks, and coverings recommended for the public. Typically the stuff that we would usually wear when we're going in and out of stores or whatever. A 3-layer knitted cotton mask blocked an average of 26.5% of particles. And the particles they were measuring, just to be, they're salt particles because they're small the same way that the virus is, but safe for these people to test. Well, a washed 2-layer woven nylon mask with a filter insert and a nose bridge is 79% on average. Other masks scored somewhere in between. And then they also have a whole chart so people can look at it But the filtration improved, they said, if you're wearing, if it's fitted properly. But we all know how much our kids move these things around. We do it ourselves when they're on. We're constantly trying to get them back up in place where they belong. We're scratching, we're, adjusting the ear things. We all do it, adults and kids. So the effectiveness of anything other than an N95 is pretty negligible in a lot of parts. So if masking is so important, I would question why we wouldn't be very specific about the kind of mask that we would require. I don't feel that there's really anything terribly unreasonable about the plan as it's been laid out. The one concern I have is that specifically in regards to the masking, we're giving away, as a board, our ability to have input in it. And I feel like based on the community's high interest in it, that's maybe not the greatest idea. I know that we need to be responsive quickly. Things are going to change from week to week according to these levels of infection. Another comment based on what Dr. Polzina said, comparing us to Australia, that is a big difference. The one thing that Australia has done differently than the United States is they've had multiple lockdowns throughout the pandemic. They haven't just had one. Yeah, I do believe that this isn't something that's going away. However vigilant and careful we try to be, it's gonna always be with us, much like before. But anyway, those are my comments, and
Can I ask for clarification, when you say giving up the authority, you mean because we would be following an external metric? Is that what you were alluding to?
no, because we're giving the administration, with this draft, part of that draft says that we are giving the administration the ability to make all these decisions without it going to the board every time, which is what we did last year with the masking thing. I feel is
But that wasn't intentional, so that's why I just want to clarify. So our intention was to follow that metric on that website, not for us to willy-nilly each week decide, hey, what should we do this week? So
I get
that's why I
that.
just wanted clarity.
I get that.
Okay.
That you're using that metric to make that decision.
Okay.
But then the other thing too is how long is this effective for? You know what I mean? Are we approving this indefinitely? Is it just for the school year? Because there's nothing about that.
And I just wanted you to know our intention was not to take control of that and cut everyone else out. Our intention was to put a concrete metric on it so we can stop having to debate about it all the time.
No, I know, I get that, and I'm not trying to.
Okay, I just want to be clear.
Yeah, I just have reservations.
Okay.
Because of how hot topic the masking thing is. But the way that you've got specific guidelines which are driving the decision of whether to mask or not, which I appreciate.
I can guarantee I do not want to make that decision. So that's why the outside metric was what we leaned on.
Plus, I don't think I'd want to be having to make the decision weekly as a board or every other week. I don't foresee this going forever. I would hope we'd want to visit that again, definitely.
Well, I think we would put a sunset date of whatever our last day of school is this year. I forget what that date is.
I don't know what's happening.
June 3rd.
June 3rd, thank you.
Yeah.
I got a question as to what constitutes a high rate of community transmission and what substantial is it? Is it a percentage based on cases and population, or?
So it is a percent of positive cases is what I'm asking Jill. She can go to that website and share with everyone that click that link. There you go. So
does it explain it?
I think so.
Yes, it's a rate per 100,000 people as well as percent positive tests.
Yes.
Where's the comment? Is it comment down below that? I was looking for.
Yeah.
It's where's the numbers I'm looking for the county data. There it is. That's what I was looking for. Thank you. That's county data right there. That's correct. Okay.
Vaccination in Jackson County, yeah.
I think all of our wish would be that we would go back to the way it was a couple weeks ago, and that no one would have to wear a mask. I'd love it.
Well, I'm just wondering, you know, we're looking at Jackson County and we're concerned about Black River Falls. That, is there a matrix out there that we could do? And I know we do have some positive cases here in the school district that would constitute to, you know, Black River Falls School District high community transmissions versus the county?
So you want to cut off the other districts is what you want. I would have to do some digging. I know that last year there was some data that was presented by a school district, but at that time I think it was just positive cases. I don't know that it was community transmission. So I would have to do a little more digging on that.
Okay.
But I certainly can, because I know there was some sort, this one is not it, but I know that Ellen shared with us that you could look at just your school district boundaries. So, but I think that was positive cases. I don't know for sure. So I will have to check on that.
Dr. Simpson?
Yeah.
May I ask a question?
You have to ask the board president, I'm sorry.
Excuse me, Ms. Wright, may I ask a question?
Is it about
With-
masking?
Dealing with this number, does that include the prison?
County would.
County. So you're taking into effect an enclosed environment and adding it to our public population. How in the world does that make any sense?
I guess what we break it down is that we're talking about the school district and masking the school district, not the county. How do we specifically drill down the demographics to deal with staff and students' families? And I don't think that's a metric that we can ever come across. So therefore, we're using data outside our sphere of influence to regulate what we do as an action.
Okay, Ann.
But there are staff that don't live in our district that travel a ways to feed, and who knows, it's really none of our business, but in this case it is, who they interact with. I mean, who they interact with when they're not at school, you know, on the weekends or vacations. I would almost think we should just go with the data from from the Jackson County Public Health and use that data to make a determination of masking or not masking.
Do we have any way of knowing if they're able to separate out the?
That's what I said I would need to check. And so the difference is, this is community transmission, not just positive case rate. And so I know that last year I could look up positive case rate by district. I know I could last year. But community transmission was a different piece. So I can tell you we've had 8 positive cases of students since August 1st. That I know, but how does that translate to high, substantial, moderate? That's an algorithm that I do not calculate. So I can do some digging if that's what you're asking, is how close. To be honest, I was kind of excited that we could do county as opposed to state, as opposed to national, right? I was a little feeling better that we were drilling down, but I recognize what you're saying, that the closest proximity to our
But that's a good point though too, also that not everybody just
lives here.
lives here.
For sure. I have to base it on some data. Right.
Okay, I think in listening to all the comments, I mean, all of us are agreeing that we want our kids in school. That's the best way for teaching, and we want to have provide a safe environment for everybody, staff and students. And I'm just going to say I'm in favor of the plan that's been presented to us, with all the time and effort that went into it, with all of the input that Dr. Severson has asked for and gotten. Is there any other comments or questions?
Are you making a motion right now?
We can.
Anyone
Anyone can make a motion. If we have no more comments, absolutely. Go ahead.
I was just curious if you're making a motion.
Okay. Is there a motion to accept the administration recommendation as presented to us tonight?
I make the motion to accept the plan from the administration as presented to us tonight.
Are we putting a sunset date?
With the sunset date of the end of the school year at least. I don't know if we're going to
Or-
revisit it before then.
I think we're just, it's going to be common sense that if we need to revisit it, if COVID goes away and we have 0 cases, we can revisit it. I mean, that's just common sense that we would do that in a timely manner.
Right. I mean, to Amy's point, if you feel like this is not doing what we wanted to do, we can revisit it.
Okay, please stop the end conversations here. We're trying to conduct our business. Go ahead. What did you say, Brad?
To Amy's point, if we feel like this isn't doing what we wanted to do, this basically gives 4 weeks of four decision points for administration to make their masking decisions, 1 per week, and then it can be revisited.
Okay.
And so something that Ellen from Public Health suggested is that it changes on a Saturday and that it would lag by 2 weeks was what she said. So here's the transmission and then 2 weeks later you would make the move. Here's the date and then 2 weeks later you would make the move is how Public Health recommended that be utilized.
And how would we communicate the level that we're at to our parents? That's what
Same way we
we always
communicate
do.
everything, yeah. School Messenger, Facebook.
Okay, we have a motion to accept the plan as presented. Is there a second?
I have a question, Madam President. What if we don't want to mask our children? Then will our children be made to left school grounds?
Okay, I prefer that we get our board business done and the details of that would be handled.
The decision shouldn't be one-minded. You should push your own decisions and how you feel about this on the rest of the parents out here. We should be able to govern ourselves.
Okay, we have a motion and a second, and are we ready to vote, or do you want more comment from the board?
Do we have a second yet?
No, we haven't.
No. Okay. Do we
I'll
have a?
second that.
Okay, we have a motion and a second. Is there any more discussion or
I move to
questions by the
table
board?
this motion, actually, until we have more data. The reason I'm asking for the table right now is because we just presented this draft just this afternoon. We haven't had a thorough time to research that, and plus there's been a lot of other data going on, including the flow chart. This is a revised flow chart. And so I think there needs to be more time for me to process this, honestly. I think that a lot of new information is coming, and we still have a little bit of time before school starts. Not a lot, I'm not arguing that. There's 2 weeks and we start in school. But I move the table this tonight and revisit this, and maybe, basically because there's so many things that have been brought up tonight that have been a question, like sunset dates, demographics, how the data is tabulated, all these things. That's why I just make a motion to table this right now until we can have a more informed decision.
For Robert's rules, we need to consider the table first. Is that correct?
As far as I did some research this
Tabling
time.
must also be
Yes, as far as I know, we have to at least look at that if somebody's second.
Okay. Okay, so there's been a motion and a second to approve, and then a motion to table. So we'll take a vote to table it. Okay? Okay, let's do,
actually need a second to table.
okay, we need a, okay, Amy has seconded the table vote. So we'll go around and do a roll call vote. Okay.
And this is on whether.
This is whether to table the vote and discuss this again at a later time. Okay, we'll start with, yes, Troy.
Yes.
Okay. Table the vote, okay. Ann?
No.
Amy?
Yes.
Mary Jo?
No.
Brad?
No.
And I vote no as well. We'll go ahead with voting on the motion and the second to accept the administration recommendation.
Before you call that to question, can I just share what I just found
Okay.
and just
Okay.
clarity?
Okay.
So there is, Jill, you wanna give me the thing? I found a site that has the positive rate per district. I don't know
Oh
that
my
it's something we
goodness.
could set
Okay.
metrics by, but there you go. So this has Black River Falls, that doesn't feel right. Positive new 1, position 7-day average, 3.78, that does feel right, but this is like overall, so total cases perhaps. Negative 7-day average, so our positive rate is higher than our negative rate. So maybe it's not all that helpful, but it gives us a 7-day average of positive to negative. I don't know if you find that helpful. I feel like this is drill down pretty low, pretty detailed, but I just wanted to share that they do have data by school district, but it does not talk about community transmission. It talks about the positive testing rate. And I just want to be very clear before you vote that we add those other pieces in the sunset date and the process for when that picture changes from red to the next color, that there's a delay until we would pivot, right? So that chart gets updated on Saturday, and we're saying there would be a 2-week delay before we would make a change, is what Ellen is recommending. So I just want you to be clear that if you're making that motion, that's how we are packaging that. And so if you don't agree with that 2-week delay, that you should specify that in the motion before you take action.
Just for clarity, Shelley, on the 2-week delay, so we get the update on Saturday, and you're saying 2 Monday, not the following Monday, the Monday following that. So
she says,
not 16 days, but 10 days or 7.
She said you should wait so it comes out on Saturday, not that next Monday, not that Monday, that week is when.
16 days, it sounds like with Brad said.
Yes.
That was
2
16
full
days.
weeks. Yeah, 16 days.
Is there a reason we can't do the second Monday, 10 day?
This is a recommendation from her, so from
Does that
public
say
health.
that in this draft?
It does not. That's why I'm describing to you guys exactly what that process looks like before you move forward.
So just to add some more clarity, if today it's high and then tomorrow we find by some miracle we're low, we have to wait per recommendation. We would be waiting 2 more weeks when it might be high again to respond to that with the mask.
Correct, that's the
That seems crazy to me.
It doesn't seem very
pointless.
effective. The efficacy of that is really low because you're actually you're
You're
following
backwards.
the curve. You're following the curve on the backside, and that's been the whole thing started with let's flatten the curve, which we did, and then after a while it shot up last November, which is normal, and then basically we flattened back down, and now we have not had a spike yet. We're trending upwards. I'm not arguing that, but we also are 2 weeks behind. So that, in other words, the data is also we're beholden to data that's not under our control. With my frustration is, I guess, right now. So, and that could be a frustration for everyone.
Of course, it's going to be a frustration.
And that's it's going to fall on you because you're going to be the one that's going to say, I'm stuck with the
Sorry,
data I'm given.
that was rude.
I know.
So whether
I was actually
we're
going to extend
asking
that
our
for you.
kids to put masks on or giving them permission to take them off, we're always behind what's really happening in real time. So that just doesn't make sense to me.
Dr. Severson, is it the 2 weeks?
Yeah, ask the board president if you can.
I invited him.
Okay, sorry.
Yes.
Does the 2 weeks, is that because of the time that can be in somebody?
That's exactly what they're saying, that you're responding to what would be active at that time.
And then if we went from a yellow to a red, we would immediately go on Monday. We wouldn't wait 2 weeks to go Monday to put masks back on, is that correct?
That was the administrative recommendation.
So the 2 week period, that's just when we take the mask off, going from red to yellow.
And it said, looking at that chart again, it says current 7 days is Monday, August 9th to Sunday, August 15th, and that is where the red came from. So those are the cases from Friday, August 6th to Thursday, August 12th. So they take them in, and then on Sunday, they give the new color for that week.
And since we're discussing still, the quarantine, and we haven't really discussed that too much right now tonight, but are we doing any unintentional consequences of getting kids to vaccinate because of the quarantine situation? Like we already had that apparently with some of the sports children, but participation, and is that unduly influencing some of the parental, basically the parental request of the parent of under 18 has the final say, but it seems like it's not directly incentivizing it, but it's indirectly incentivizing it, so it's unintended. Is that something that we are willing to stand behind too?
What would you suggest instead?
That we don't take a vaccination into consideration for quarantine like we did last year. I know it's not what's recommended, I'm well aware of that, but it's a modification of the Wilson proposal, I'm well aware of that as well.
So
But if we
just,
don't,
just for clarity,
Sure.
I wanna make sure I'm understanding correctly. You're saying that vaccinated individuals should still have to quarantine so that other people who aren't vaccinated aren't unduly influenced to want to vaccinate.
and also the fact that the vaccinated can also still transmit the disease. That's a big factor of it as well. So therefore, I'm just saying, if you look, that's what data says right now too, that the vaccinated can still transmit it. So
you're suggesting that we are more restrictive than CDC recommends as opposed to less restrictive?
it's a possibility, yes.
I'm just clarifying.
And honestly, that is what I'm saying, yes,
Okay.
the quarantine
I just wanted to be
procedure,
clear.
yes. Yes, and that's something that did cause, obviously, we were not able to open last year because of all the
And that
cases
would-
that were under close contact. I'm
That
well
would
aware of that.
significantly alter our staffing situation,
Agreed.
significantly alter our staffing.
Right.
My hesitancy with what we have right now is the 2-week lag time. And I guess this isn't necessarily even a question for you, Shelley, but maybe the building principals. I mean, can we react within 48 hours?
Go ahead and respond.
I mean, if we have, it's 2021, we've got text message, we've got the voicemail system. I mean, are we comfortable?
It's a mask, so the worst case scenario is that we would be providing disposable masks, just like we did last year for students who don't have them.
Yes, that don't work.
Okay,
And we have,
you have something?
Yeah, I was just gonna say, if we're doing it, going from, if we go red to yellow, right, from Saturday to Monday, and a kid comes to school with a mask, and we
Right,
say, you don't need to wear a mask today, then they put the mask in the pocket, right? It's, the other way, it's 2 weeks, kids will have 2 weeks notice that we're masking, right? No, sorry.
Other way around.
Sorry.
I think
It's a recommendation. It is yours to alter, modify, suggest. I mean,
So we've already added in the sunset date of what we want, with the consideration of reviewing it as needed according to the statistics that we're seeing. Is there anything else the board wants to add on to the motion in the second?
I would say that if we're going to give a less restrictive treatment to those who are vaccinated, we should also give a less restrictive treatment to those who have had COVID, because they carry the antibodies as well.
Would that be very hard to manage? I mean, do we know who's had COVID?
if it's reported to us, we do.
Otherwise, we don't.
We have a fair idea of who many of our students are, and our teachers who have had it.
And I mean, like the other research that everyone says, I mean, that isn't completely true either. I mean, I know of a family member who had a severe case of COVID and has no antibodies, and was recommended by the doctor to have the vaccine because of the illness. So, I mean, like everything, there's opposite. We hear opposite one side and opposite the other. I mean, we just have to come together and decide what's best to keep our kids in school and keep them safe.
I think this is a starting point for us. I think it's quite a complete document. I agree on the lake time, there might be a problem there, but I think we could tweak that if it becomes a problem, as we see it.
So, just to follow you up, Mary, Joe, we're gonna revisit this earlier than the sunset date then? Is that, is that something we should review on a monthly basis, or is it something?
Whatever the board
Well,
decides.
we always have a COVID update during our meetings. We did throughout, since the beginning of COVID. We had that on the agenda, but we can certainly be more intentional about different data that everyone wants and have it more complete if you want.
Well, the whole thing is we're doing this for the whole school year, so then we set a policy in motion, and last year it was an issue of no masking in March, even though it was no longer mandated, but because there was no notice given to parents was a reasoning that we stopped, we continued masking. Even though the data we're on the decline, and we still did it because it was convenient for the parents. So now if we're gonna say we're gonna view it every month, or even just basically look at data points, are we gonna switch it based on at a monthly basis, and let's review it, or are we gonna go and say, well, we got it for this year, we're gonna keep it this year no matter what? And then also the other thing too, going back to the flipping it back and forth between red and yellow, we're gonna say to the parents, today you're masking your kid, tomorrow you're not, and there's a delay there, so there will be notification there, but the parents and the kids, it's just setting up a lot of inconsistencies that are going on, and that is difficult to maintain as a parent. Today, today you have, Mr. Student, you have to wear a mask, and I can tell you, little kids don't understand what's going on. I mean, kindergartners are nowhere near that have the capacity to understand what's happening right now. So today they're masking, next week they're not masking. I can see this causing a lot of confusion for them. And also, I think it does interrupt learning. I mean, I could tell you that when my son was, basically, this is from a parent again, when my son was unmasked, he reads better. He just reads better. It's a less of a distraction. He can hear himself better. All these factors come into play. I have a family member who is an SLP, and she, my sister, just so full disclosure. So anyway, there is a definite distinction of learning and how habits are formed based on masks or not masks. That's how kids learn differently. It's just, and that's, I think that's irrefutable. I'm not saying it's positive or negative. It's just the fact that it does change the way the children learn. So back to my original point was, if parents are allowed to choose for their kids, this is, I mean, I know the emotion's already been in play. I'm just saying that's where I stand from, is with the parents can just choose at discretion, and I think that's fine. Optional is we're asking. I'm not asking for, and I think the parents who are in the public comment are not asking for any kind of no masks, you can't wear a mask. They just want the option, and I think that's what we should actually go with.
And we also have comments from parents who expect safety for their children and believe differently. And so, I mean, it's a balance that we have to decide here, what's best for all students, and all students deserve to feel safe.
Right. And the last thing was, you know, the case Wisconsin versus Yoder in 1971, which said basically that it was an Amish case. It went over to the United States Supreme Court, and basically that said that the school district has rights given to them only chosen by the parents. That case there could be applied to this too, only in the sense of parents should choose the health and also the education of their students. And that part of that is I agree with, and it works both ways. I'm not saying mask or not in this case, but I think when you have a majority percentage of parents who actually are the constituents of the school board, when they say, the majority says, we don't want to have masks, or we don't want to make masks optional, I think we have a responsibility to listen to them a little bit.
I'm just going to age myself a little bit. I mean, I've been through a lot of things in my life that we're not happy about doing, and one of the most recent ones, being in education, was, think back when HIV was prevalent, and we had to change every way we did bloodborne pathogens, and how that's just no one liked it. No one liked to mask up and put gloves on and do all that stuff. Of course, I mean, and it was hard for children because we were limiting their interactions and stuff. And it seemed like because it was done and it became common practice, we seem to be okay with that, and with lots of research. But you know, I made the comment about if COVID goes away, I meant that if the statistics are showing improvement, and I know I got a lot of reaction of that. I do recognize that COVID is here, but I think this is one of the ways that we need to be addressing it, and we don't have to be making a new decision every month, but absolutely, I think we have always to have it on the agenda for discussion and update, so we all are on the same page of information that we're receiving.
Troy, I hear what you're saying.
Yeah.
Our big problem is half the people want masks, half don't want masks. I think it's pretty almost divided equally. So
it's perception, I think, in that case, but yes.
Well, I looked at the numbers, the same numbers you looked at.
Yeah, the same numbers, but 60% said no mask or mask optional. 30% said.
I didn't see that.
Is it okay to pull that graphic back up?
Oh, I'm not going to argue with you about that, but I feel that our community is equally divided. And so I'm trying to do what's best for everyone. I realize there's people that don't want masks.
I'm not trying to speak to anybody here right now. I'm just talking to everybody here because we're all parents. I'm pretty sure every single person on the board is a parent. And I think we'd all want the most control we can of how our children is treated, no matter where they go, school, to their job, wherever. I mean, obviously a job is a different thing, but if you think of a minor child with a job, you want to make sure that that child has every opportunity given to him, and you want to make, that child, and you want to make sure that they're done safely, which I agree with.
Right.
But at the same time, you also want that child to learn under how you want them to learn. In other words, the conditions. You don't want to have to go to a hostile work environment. You don't want them to go to a hostile school environment. Correct. You don't want that. You want to give them every opportunity, and that's really where the parent shines. Is the parent goes, I know what's best, and I know what's might not be better for this child. That's okay. He's not my child. This is my child. My child needs this condition or this environment to learn best. And that's what I'm saying is where if we give everybody, and I understand there's a lot of people that view opposite, and I think that maybe we can. That's where I said my previous motion. But if we could revisit some of this and maybe look at other options, we still have a little bit of time. I know it's a lot of effort required, but that's part of what we're here for. Is we're here to serve the community the best way we can. And I think sometimes looking at more options than just here this is today, I feel like we're being a little bit. I don't want to use the term railroader, but we're not giving adequate due diligence here to look at the data. That's what I'm trying to say. So.
I thought it was very powerful when Dr. Polzian said that he would not let his children come to school if there was not a mask mandate. He's a physician. That was very powerful.
As well.
Okay, everyone in the audience, please, we're trying to
Shelley,
conduct our business. It's distracting when we can't hear each other. Please.
I found that very powerful. He's a medical person, so that did resonate with me.
I absolutely am not trying to railroad anyone. This is the collective best
That's why I said
intentions.
that.
And so, what other information do you need? Because this is my personal belief.
Okay.
People believe very strongly about masks one way or the other, and I think we talk past each other, and we've talked past each other for months. I don't know that anyone is going to change anyone else's mind. I really don't know that. And so I just have to throw that out there because of what else do you want from us for more information?
One word.
Yeah.
Cohorts. Cohorts for parental choice. I know it sounds hard.
Yes. Oh Lord.
I know. I understand, but that is an option. You asked what options you were.
Yeah, you're right.
So that is.
So let me just offer this.
Sure.
Right now, when class lists are made, the previous grade level fills out information sheets on every one of those elementary classrooms. So I'm going to talk K-5 because that's really
fine.
the most functional right now.
Yes.
Those class lists are balanced by academic performance. They're balanced by parental requests. They're balanced by behavior situations. They're balanced by other supports in the classroom that are available. Those class lists are incredibly time-consuming. Mm-hmm. So to rip all that away and just say your mom wants you to wear a mask, your mom and dad don't want you to wear a mask, therefore that's how you're divided.
We do that with one other subject in curriculum. We do that with human growth and degree development with sexual education. We notify the parents. The parents have the option at that point to pull their kid from that curriculum. Is that correct?
Yes.
Yeah.
Okay.
Yes.
So therefore, we accommodate the parents' needs.
So you are correct in that. That does happen, and I would say one child out of a class of 115 gets pulled.
But
and
what if it's half the class? I mean, you would have to make that accommodation either way. Just saying, half of a grade level.
That is for one day. I mean, human growth and development is a one-day lesson.
I think that too. I'm not arguing
and
with
so then let's get to high school.
Part.
How does that possibly happen at the high school level? So we teach one section of AP Psych, but half are making the choice, some are not.
I know. I think we should do due diligence is explore all options here. That's what I'm saying. And so that's all. I know it puts a lot of burden on you and the
It's not about the workload. It's not about the workload. It is not, because this group has moved mountains over the last year.
I agree.
And
not
awesome just
job,
them,
yes.
the teachers that they serve. They have moved mountains. So it's not about workload. It's about, we're talking about a complete upheaval, and then let's talk about segregation, right? So are we going to cohort the masked kids get to do this, the unmasked don't get to do
We're
that?
doing that with the vaccination, with the quarantine program. That's segregation.
But that's when they're leaving school, not while they're in school.
But it keeps kids in school if they get their vaccinated. Is that correct?
Literally.
That's segregation as well. So in other words, it's a complicated issue. There's no easy answer to this, but I just wanted to be, it's nice to actually be able to talk about this in a group. Just that we haven't done that either. That's part of my issue with this. So I just want to have all choices exhausted before we go ahead and before I support this is what I'm trying to say. So as it stands right now. So.
Fair enough.
So the issues I still want to talk through is the lag time, I guess. So I don't feel good about the 2 weeks. If we feel that the high school students or we dropped from we dropped to moderate, I don't want the students wearing masks 2 weeks longer than I feel is necessary. If I like the idea of having disposables on hand. If we feel that we're able to respond within less than 48 hours, I think that's the way to go. It, to Troy's point of would be to use your words behind the curve. I don't want to be behind the curve. It's all the freedom we're able to and protect the students as quickly as we're able to.
So you would like an immediate turnaround? Data, it's Saturday, announcement to family is Sunday.
I think so. I mean, I'm looking the administrators, is this impossible? Are we asking the impossible?
And I just said to Dan, I mean, I understand your concern, but how many kids show up on a snow day? I mean, we have a snow day, And so I think you just train yourself that you're looking for that message on Saturday or Sunday that tells us what's coming for the next week. We just have to change our thinking a little bit, and it becomes a new normal, but we're gonna use that before we do. So I don't think that's an issue.
Okay.
That would be something that
it's possible.
I think it is.
I see some head shaking. Do you think that we'll do the best we can on that? Okay. So we have a motion and a second. We've added with a sunset date of the school year with review of the statistics on a monthly basis or more often if we need to, I guess.
And I need clarification on
Okay.
that, and I am not trying to be obtuse here, but what does that mean? You want to see where we are? You want me to show you the chart? You want to open it up for discussion again? Right. You want to, tell me what you're looking for if we're going to review it. Every week you can go to that website and see what color we are. Are you suggesting that at some point it's going to say red and we're going to say that's not as dark of a red? We shouldn't be asking? I'm not trying to be sarcastic, but I need, what do you want to review? If it's color-coded.
What I was thinking, just what we've done in the past year, every month you gave us a COVID update, and that's how it was labeled, and whatever the situations were, you were updating us on any concerns or adjustments that needed to be made.
And so just for my own clarity in helping to create the agenda, if any board member wanted to, if this is where you go and you wanted this change, you would say, Shelley, put it on as an action item, we want to review this. That's the clarity I'm looking for from you. And I think the people who are here to advocate want to know, do I have to come every month to advocate, or do I have to come every quarter? How often do I need to come advocate? I feel like we're trying to gently kick the can as opposed to this. Again, we all just want some clarity. So we can review it, but you're going to know what the color is, right? So if at some point one of you says, you know what, we've been red forever and I haven't seen a positive case, I want to review that and see if that's still the best way. Great, we can do that. But to say we want to review it each month, what does that mean? Do you want people to come advocate again? Do you want me to, what are you?
What I'm thinking of is just what we did last year, where you just had a COVID update and just gave us a summary of what's been happening in the school and what the needs are, where you had successes, where you've had concerns, and what your forecast for the future was. I know you gave us a little heads up on when we were running out of staff to teach in person, and we had a good update on that. And
so you're saying we wouldn't talk about the mask agreement if that's what we decide on.
If
just be an update.
Okay,
I think we just need an update from the administration, because we're not in the classroom, we're not in the schools every day, so we got to find out how is this working.
All good. I just wanted clarity whether we're reconsidering this every month or what that plan is.
No, that wasn't my intention.
And I have one other piece of feedback for you. I absolutely agree with you that every child learns differently. I absolutely agree with you. I would just remind the board that we were able to have a pretty large celebration in July that despite so many things happening last school year, we had some amazing growth out of our kids across the system. And so absolutely, could it be better? Yep. Could some kids learn even more? Absolutely. But I just really want to make sure that we're not communicating in any way, shape, or form that this is prohibiting learning, because we saw some great data celebrations in July that we haven't seen in a long time. So I just also wanted to share that.
Well, I'm not trying to be incendiary, but our district motto is excellence in education. And are we sacrificing that at something else is the question. So that's the question that we all have to answer ourselves. I don't know the answer to that, but that's just a consideration for all of us.
Okay, I'm just gonna ask Marty, are you clear with the motion, Marty?
I was just gonna have
Okay.
to clarify. Okay, so, I have Mary Jo, making the motion, Brad seconding, that a word?
Yeah.
Approve the information as presented with a sunset date of June 3rd, 2022, with a monthly COVID update.
Just an update, yes.
And the 48-hour response time. I don't know how you want to term that. So the information will be updated on Saturday, and that the change per this will occur the following Monday.
Okay.
2 days later.
Immediate reaction,
yes,
right? Immediate reaction.
Immediate reaction. That's a good word. Okay. Any more board comment or questions? Are we ready to vote?
I think before we vote, I would just like to say, thank you to all of you who did your research and presented. I don't take this decision lightly, and I appreciate your time and effort, and and doing it in a positive manner. I truly appreciate it, and I read your comments, I read your posts, and so again, I am informed from your point of view. I do my own research, but thank you very much for your public comment.
Thank you. Okay, any other comments or questions? Okay, we'll go ahead and vote on the motion as Marty read, and we'll do a roll call vote again. Troy?
No.
Tom?
Yes.
Ann?
Yes.
Amy?
No.
Mary Jo?
Yes.
Brad?
Yes.
And I vote yes as well. Okay, motion is carried as presented. We'll move on to employment recommendations.
At the risk of being a horrible human being, we said we were pivoting quickly. Does that mean tonight I send out communication that says starting tomorrow, anybody within the school buildings of the school district of Black River Falls is expected to mask? I should have asked that before the vote, but I just need clarity.
I think in order, okay, start by
I word that 8 p.m. is too late. I think, what is today, Monday? I think this has to go into effect time 6 a.m. Wednesday morning. I don't want people scurrying if they're not prepared. I mean, some of them are going to bed.
So we're talking, we have staff coming in tomorrow and new staff.
Yep, this week we have trainings. Next Monday is the first all staff is here.
I think if we are following our own example, then we could provide people with masks tomorrow, because we just said it's going to go in effect. My feeling is if it either goes into effect or it doesn't.
Wait, could I ask for an motion on that, just for clarity?
Sure. Well, yeah, there is no, it is a draft, and now it has been
approved,
but without a start date.
Okay, so is there a motion to, Mary Jo, would you like to make a motion to start it tomorrow or another time?
If we felt it was important enough to pass now, I would make that motion to start it tomorrow. Otherwise, I don't think it was that important.
Okay, thank you. Is there a second?
I'll second.
Okay, Anna is second. We have a motion and a second to start our masking rules tomorrow. Any discussion or questions? All in favor say aye. Aye. Opposed? motion carried.
Principals, please make sure you have some disposable masks in your buildings for anyone who comes in. I'll probably send out a staff email, but not a phone call this evening yet.
Thank you. Okay, we have lots of new employees to approve here and a couple of resignations.
Great.
I think there's some people who are wondering if they can come and sit now that some
For
others
sure.
have left.
For sure, if that's what they like. There's
Thank you, Nicole.
So you see the employment recommendations in front of you. If Mr. Nortman wrapped up his last two, I think we have all of our teachers hired.
Wrapped up one, almost on the other.
One more middle school teacher, and then we do have several support staff positions that we are still looking to hire. We have two individuals that I'm just super excited about, that they have been longtime aides for us in the special education department, but they had bachelor's degrees, and they are both going back to school to earn their teaching certification. And that's exciting when you have people who you've already invested in, they've been here, they've been doing great work, and it's exciting to see them take on that additional responsibility. So we're really excited about that. We do have several non-certified teachers, but that is definitely the path that we have been down the last couple of years. And I would just share that sometimes those individuals that have other work experience, life experiences beforehand, have this amazing gift when they get to the classroom because they've lived another life other than being a teacher first. And so I'm excited about all of them, and we're really close to ready.
I have one question on this,
Yeah.
just out of curiosity. For Ms. Paczynski, she was the dispatcher, just transportation supervisor. What position was eliminated in the transportation department last year?
So I think we talked about it very briefly in the spring. Christy was the dispatcher, Jeff was the transportation supervisor. The hours that the bus garage phone needs to be covered are too many hours because they're there by 5:30 and then need to be there until 5 till buses are empty. And so Joey Gilbertson, who lives in this office, is going to do the AM dispatch responsibilities. So Christy doesn't have to be there as early. So we've eliminated one full-time person, but it's half, Christy's gonna do half dispatch, Joey's gonna do half dispatch, and Christy's gonna do the other transportation supervisor. So we've taken two full-time people and one and a bit of the work that Joey was doing. And Joey's very excited to be here at 5 in the morning, which that's not my jam, but she's really excited about it.
So I was asking, we eliminated that position and now it came back up.
Nope,
No,
that,
we didn't.
so
Position is.
this month Marty decided to put all these moves and transfers on here.
Okay.
You had already previously approved that
Okay,
one.
that's fine.
and
I
I've
just-
seen that one, sorry.
Fair enough.
I was not understanding you, that you thought we were re-adding, no.
No,
it
no,
is-
okay, that's fine, yeah.
Yep, she just put all the moves and transfers on this time for
Cool.
clarity,
Alright.
but it provided a lack of clarity. So.
Are there any more questions about the employment recommendations? Okay, is there a motion to approve?
I'll make a motion.
Thank you.
I'll second that.
Thank you. All in favor, say aye. Aye. Opposed? Okay, motion carried. Student success, CTE.
All right, I'm excited to talk to you about this one as well. You know that Ryan Johnson has been working really hard to build additional opportunities and partnerships with businesses in the community. We have more students earning their industry credentials while they're still in high school than we've ever had before. And in large part, that's his work, but it is also the rest of our CTE teachers who provide opportunities for the students to take, like Jaron Cassidy, he does the auto mechanics. He works with Gross Motors to get kids ready to take that test so that they can earn the mechanical industry certification. When we earn those certificates, the state provides grants for those. It says $1,000 per student, but it's not really that. They put a dollar amount in a pot, and depending on how many students across the state earn that certification or a certification, that's how they decide how much the reimbursement is. This year, our amount is $14,357. And what we do is we put that money back to the CTE department, because if you think about those departments, they're the ones that have a lot of large capital equipment, right? The Tech Ed Lab, they can buy one new piece and it's $25,000. And so we bring that money back to the CTE department. We also use it because there's a fee for the students to take those tests. And so sometimes we offset that fee for them to take the test by that grant dollars that we receive. So just wanted to share that great news that we're up to $14,000 that goes back to the CTE department. And that means that kids are walking out with more industry recognized credentials. So that was a celebration.
Awesome, thank you.
Okay. Speaking of celebrations, we shared that the high school credit recovery was way more aggressive than it ever has been, and it was really interesting. I talked to several of the staff members who were working there, and they said that it's a similar content that they've used in the past, but they think the difference was it was really small groups, and they said there was a ton of cheerleading. These kids were getting up in the middle of summer, and they were coming and getting their work done, and very small groups, so the staff and student relationships were just amazing. And Kim wasn't technically working yet, but spent a lot of time there. Luke had just started, and that was his first stop. And so the group of staff members that I put in your notes really just did an amazing job. So if you think about that, 127.5 credits earned in a 4-week span, that is really exciting. And so I shared previously that summer school was far more expensive than we normally spend on summer school, high school summer school. We made that investment because of the negative impacts of COVID. I think we are going to have to collectively keep talking about that and see if we think that type of summer school is our best bet moving forward, or if we want to go back to contracting with WTC and having them do that summer school. That leaves us out of that relationship building that we think was a huge part of the success this year, but it also becomes a student responsibility to get down there, and sometimes kids rise to the challenge because they're going to the technical college campus, which feels more grown up to them than going to the elementary school. But I just really wanted to recognize all the high school staff that organized that content and all the teachers that just really helped do that work, because I think tons of kids that will be on target to graduate on time that weren't going to be there before this summer opportunity. So very pleased with them and proud of them.
I'd like to applaud that 3.5 credits earned 2023 graduation. Passed geometry A, B, algebra 1B, English 9B, PE, world history A and B.
Kim, that's when you say, I worked with that kid. Just
I think there were like 4 of them that passed 3.5 credits. I saw in here.
So that means they did 7 modules. They did 7 course modules over those 4 weeks. So good stuff.
That's good news.
All right.
Good. We're on to finance and facilities. Monthly expenditures are first. You received those in your packet. Does anyone have any questions or concerns?
I just had one. I kept seeing that Galapagos trip come up here and there on the financials. Is that just totally done? Remember?
I absolutely remember it. I don't know its current status.
I saw it come up a couple times on there, and I didn't know it.
I don't know the current status either.
So high school, that's something we're going to need to check with science. Our previous science teacher had scheduled a trip to the Galapagos, and I'm guessing kids did fundraising. Is that what you're saying? Okay.
Those might have been refunds too.
Oh, could be.
We'll check into it. We'll check into it.
Okay. Any other items for discussion? Okay, is there a motion to approve the monthly expenditures?
So moved.
Thank you. All in favor say aye. Aye. Opposed? Okay, motion carried. Facility update, we have a groundbreaking coming up.
Yeah, these are the big project signs that they are suggesting. So we did confirm that on September 14th, there would be a 1 p.m. Groundbreaking at Forest Street down by the lower parking area, and then at 5 p.m. that evening, there would be a groundbreaking by the west gym of the high school. And so we are still working on putting together those programs, but they make those great big project signs, and so there will be a great big sign of both projects available at both of those groundbreaking events. And we're going to talk to the high school band about getting them involved there. They're going to bring in a bunch of shovels or sand and golden shovels, so the elementary kids will be able to play a little bit in there. They passed on the hard hats because they said they've had too many little kids get injured by the big hard hats, and so they said no thank you. But so anyway, that September 14th is the date, and we'll give you more information on that. I also included in your packet kind of the running story of the Red Creek Gymnasium. Jill prepared that for our insurance provider. Bartongale Electric has been a longtime partner of ours, and they were the successful bidder on some of our work moving forward as well. And what they have determined is that they were walking up on top, doing some maintenance and stepped on something that bent the vent, and that's what let all the water in repeatedly. And so they have accepted that responsibility. Now our insurance company is talking to their insurance company. And so the document that you received is our step progression of what happened, document, and now the insurance companies are battling that out. Unfortunately, we don't think the gym floor will be completely repaired by the start of the school year. You will see it on Thursday night when we do our tours, but they're going to make it manageable for this year, and next summer we think there's going to be a complete gym floor replacement. We think they're just going to start over because there's been so many spots that have been damaged in there over time. So.
Speaking of gym floors, I was at the middle school and it looks to me like it's wood.
Maple, it is.
Okay.
Yep, I should have emailed you out, it's maple. That question came out during the board meeting.
Oh,
If it was
when that was
synthetic or
not?
maple, and I can't remember.
Maple.
It is maple, it's wood.
It looks nice.
So Monday we are scheduled for our facility tour.
No,
Thursday. Thursday, today's Monday, we're scheduled for our facility tour. 5:30, we will gather in the Red Creek Commons to call the meeting to order. I've got the big diamond van, we'll walk through Red Creek first, then all aboard. I'll drive you around to the rest of our facilities and ask any questions that you have, and all those things. We'll do the bus garage as well. I will tell you, Jill and I are both having some palpitations about the timing of the bus garage. We really needed to move our buses this week. The staging at the high school where they put the concrete barriers really took the vast majority of the student parking. In the pictures, that was going to be there was going to be student parking back here and still an area to drive. The way they have it right now, there's not a lot of room for parking and driving, which means we need our buses out of there so that we can lay gravel and make more high school student parking spots in that back area. They were not able to do the blacktop at the new transportation site because of so much rain. And then they left Jill a message saying, yes, we'll be in next week. And she very wisely called and said, what about this week? It's only Monday. The 30th, we need all this stuff to happen. And so we honestly were just throwing out ideas before the meeting. If we have to park all of our buses out here in this empty spot, so that we can prepare some student parking, that might be where we land, but we're really pushing Geyer to finish our project out there. Today was supposed to be moving day. The other part of that is we have all of our college crew still here to help move all that stuff. Once we lose all of our college crew, then we have our regular custodians who teachers are also demanding of them as they're trying to get their room set up. So we really want to be able to move this week if at all possible.
So did you hear back from them?
They heard us.
Talking to Matthew. Yeah, I said,
Okay.
we were scheduled last week, what happened to this week? So we'll see what happens.
Okay, thank you.
So that's what I have for facility updates.
Okay, any questions?
Looks like they're going at it at 4th Street.
I thought Melanie was gonna throw herself under the backhoe because they were ripping up the plants. Wait, you can't take over plants.
Not me, not me.
Your staff was.
Okay, next item is action item for the annual operating resolutions that have no changes from previous years. Any questions?
I know Jackson County Bank is changing ownership.
Oh,
It's
update their
happening this
name.
month. That's happening this month.
Update their name. Thank you, Amy. I did not catch that.
Anything else? Is there a motion to approve the annual operating resolutions?
With that edit.
With the edit, yes.
Yep. I'll make that motion.
Thank you.
Second.
All in favor say aye. Aye. Opposed? Motion carried. You received the meeting minutes in your packet. Any additions or changes needed for those?
Make a motion to approve the minutes as presented.
Thank you. Is there a second?
I'll second.
Thank you. All in favor say aye. Aye. Opposed? Okay, motion carried. Dr. Severson's report.
All right, I have a few things. Is there a board member interested in doing the all-staff welcome on the morning of the 23rd? Typically, you've done it. You certainly are welcome to. I wasn't sure if that was something you wanted to do or if you wanted somebody else to have that opportunity. And you can think about it, but we usually have somebody. Thursday, Red Creek, 5:30. Wanted to share with you the Oh, transcripted credits, that was something else that I got well after the agenda was done. So every time we have a CTE department review, we always talk about how many of our staff members go through all of the rigmarole with the technical college to be able to offer high school students college credit at the same time they're getting high school credit. So these are all courses that are taught by Black River Falls high school teachers, and the kids are getting high school credit and college credit for it. During this past school year, let me look. Western Technical College was able to provide over 12,000 college credits valued at just over $1.8 million to students within all of their school districts. In Black River Falls, there was 159 students who earned transcripted credits. So if you think about our high school population is less than 500, so 159 of our students in a COVID year earned college credits, and those 159 students earned 570 credits total, 570, for a total savings. So these teachers doing these extra steps and doing that work, the students and district did not have to pay for that. It's $81,000 worth of post-secondary credits that are in those kids' pockets that can never be taken away from them because of the partnerships that the staff have created. That's pretty amazing. When I get to the Tiger Tribune, that is going to be front and center, and I was going to call Jody Brooke and ask her to do an article on that because $81,651 worth of post-secondary credits that those kids have already earned. I think that's fantastic. So I just got that today, so it was not in your packet. So you perhaps remember that in the past we've had complaints from coaches that we have a lot of athletes that go out for the sport, but then they're not able to participate because they don't follow through with getting their sports physical. As we were going through AD, athletic director, activity director interviews, that came up from several of the coaches. So we said, let's do some brainstorming around this. Dawn Jacobson, who's our trainer, went to the Black River Memorial Hospital, and they agreed that through their clinic, they were going to offer sports physicals at a reduced rate, and we're going to try to make that convenient for them. And then Elizabeth went and talked to Crone Clinic. They actually decided to come on site. So tonight and tomorrow night, doctors from the Crone Clinic are at the high school. They've got 33 student athlete WIA physicals scheduled, and they're charging the students $40 for that physical. So I'm super excited that both medical providers were willing to partner and just see if this increases more people to participate. So the two docs came on their night off, and it's just a quick WIA physical form, and away they go. So that's fantastic. That is it for my list.
Okay, any questions? Okay, we'll move on to.
I have a question.
Okay.
Now that mask mandate's in place, what do we do with enforcement? Because who is the enforcer of this, and what is the actions of that enforcement? Is that something we're drafting up now in the future, or?
So last year it was, we have a mask mandate in place. You must wear a mask or you may not be in school. Okay. So it was comply or not comply.
The last thing was that now is it going to apply to everything in contracts, how our space then is a building? In other words, is a building 100% mask, or is it something that only during school functions we're masking? That's the second part of that question, because it was an issue last year, so we just want to make sure it's okay. How we decide. So then was that something we got to write up still, or is it absolute? I guess how does the board perceive that is my question.
Yeah, I don't think we can control other organizations and other people. I mean, we're in control of what our school functions are. So, I mean,
I would say as a board, we're not in control of policing them, but we're certainly in control of saying that if you want to use our facilities, we're requiring that you mask.
Right.
And so then we're going to run into the same situation that we say it, but then we're not there to enforce it. And that was the
concern. Yeah.
Then are they cleaning up and sanitizing everything when all those people leave, or is that left to our, or are they paying our custodial staff to do all that?
Yeah.
So if it's at the Lunda Center, they pay for that custodial time. If it's in our district and it's not a district-sponsored event, so like a rental, they pay custodial wages. That is part of our facility use agreement.
Do you think we should have signs that say masks are recommended if it's a red time, like they do at other places, or I don't know if that's feasible? We can't enforce it.
Well, you can with your rental agreement, actually. If I understand.
But not, because someone would have to be there to enforce it, right? So a mandate without any enforcement, is that really? Because we can say it.
Well, technically, the mandate that we're existing under with money mandate right now are enforceable without any action right now. So in other words, they're not enforceable. So therefore, we're not really going outside of a boundary of legalism if we say we need you to wear a mask if you use a property. I'm not saying you are no longer. No one is liable. The administration wouldn't be liable for it anymore because you did dictate that to happen. If they don't comply, the lack of enforcement is nothing. There is no consequence for lack of compliance. So I'm just saying, is that something we put in the rental agreements or not? I guess because it is a school property, and if I understand the board does control, not control, but we oversight over what happens on the school property. So
I'm confused because I feel like what you just described is exactly what you were frustrated by last year. That there was a mandate, but it wasn't followed, and then you're disappointed that we didn't enforce it. And so I'm confused by that.
Agreed. I understand that it's without enforcement, it's something that is difficult to have forced compliance. I know that. I do get that. It just that's a perception issue, but it wasn't anything that was broken in policy. But now I'm asking, since policy has said that we have masks on site, do we enforce that across the board to everything that uses it? I mean, I know that's going to be difficult. A lot of groups that may be discouraging them from using the facilities, but at the same time, again, it's perception again. Do we perceive that we give special treatment to outside groups that we do to our own students? That's
what would you like to see different than last year's? What I'm really not understanding, Troy, I'm sorry. Because last year we told them they had to wear masks.
Okay.
And then I wasn't there and you told me that they weren't wearing masks, and then you said that I didn't enforce it. And so I'm saying when somebody else is renting our facility, we are not there to police it.
No, but as it will be part of the rental contract. That's what I'm asking.
I would think so. It says the current mask recommendation for within our school buildings. So I feel like that's where we were headed, but I don't know if that's really going to appease that.
All I'm saying is if it's in the rental contract and it's not, and you can't enforce it, I'm not going to argue that. You can't enforce it fully, but at least it's in other words, you have what you're going to gain by doing it in the rental contract is liability control as well. So that's what I'm asking for.
Okay. Yes, we definitely can do that. Okay. Definitely can do that.
Okay. Anything else for Dr. Severson's report? Okay, move on to WASB. I do not have anything new. We're working on policies and resolutions committee. We'll be starting up this fall, and I'm not sure whether we'll be meeting in person again. I know Dane County is really shut down again, so I'm not sure. So we might be going back to virtual. Any conference and workshop attendance from anybody?
So I saw the blocks of rooms are open for.
Exactly,
Well,
that's what I was just gonna say. Rooms for the State Education Convention in Milwaukee are available now for me to speak for. Actually, the 18th that opens up. So the conference is going to be held from January 19th through the 21st. So I would just, if you guys could think about it and just let me know by the 18th if you're wanting to attend. Okay. That way I can get a correct amount of rooms reserved.
And so for the new board, were you going to explain what it is for the new board members?
No, go ahead.
Okay, so for the new board members, what that is it is a joint, it's called the Joint Wisconsin State Education Conference, and so it is WASB, the school board, it is WASDA, my professional organization, and WASBO, Jill's professional organization, and they host a massive education conference in downtown Milwaukee, and so there are literally hundreds and hundreds of sessions to choose from. Oftentimes we will go down as a team and kind of strategize which sessions people are going to so that we come back with a wide variety of ideas. It is 100% optional. Typically Wednesday, Thursday, Friday are the days with the most sessions, and so the district of course would pay for your room. If you are interested in going, you're highly encouraged, yet we get that you have jobs and lives and so perhaps are not as able to be available. You don't have to commit to all 3 days. I would tell you that Friday is a half day, so if you're not going for all three, I wouldn't pick that one because there's not as much content, but Wednesday and Thursday are both pretty full days. Because it is a joint education conference, they get in some really, really high profile national speakers that just really have some interesting things about education. And so when we go to the session, sometimes there's a lot of affirmation like, oh, we already do that really well, good for us. And sometimes they're, oh my God, I never even thought about that. Let's follow up with that district later and see how they're making that happen. So we'll just share that that is a choice for all board members, and because it is every 426 school districts in the state of Wisconsin, those rooms that are connected to those sessions go really fast, and so we usually try to get ready to reserve the rooms early so that it's a choice if you are able. So I don't know if any other board members who have been there would like to add any 2 cents to that, but
It's a really great opportunity for everybody to get, for at least for those who are able to go, to get to know each other better.
yeah,
It's
a little
really-
social time too.
It is, it's nice in that regard.
Very
And
good.
I'll drive a vehicle, but you don't have to ride with me if you don't want to, just to be clear.
Well, when it's a snow or ice storm,
Yeah.
it is nice to have somebody else driving.
Okay. School board connection opportunities.
Oh, just over a week ago, I had the opportunity to go on a canoe trip with the Red Creek staff.
Oh,
Nice.
And when we got to a sandbar, we played a little game of bocce ball, and I said that, you know, there might be a school stipend for the winner. And
Oh, you did. You did.
So, well, I won, so. So pay this window.
Okay.
I have a school district of Black River Falls mask. I'd be happy to share with you. How about that as your token prize?
A good time was had.
A few of us went to the new teacher breakfast today, and I understand tomorrow you have
New support
staff.
Mm-hmm. And then next Monday is the big kickoff. And so you're very welcome to come for breakfast. It's at the Lenda Theater. Breakfast is outside the theater, and then we move in, and we've got our usual CISA 10 will come and talk about the MSDS and whatever the not very fun stuff, and then
The bloodborne
hopefully we'll talk
pathogens.
about some fun stuff, and yeah, so it's kind of a nice kickoff and kind of packaging of the year for all of the staff, and it's a nice time for everyone to be together. So if you're able to join us until like 10 is probably when that morning will wrap up, but of course come for whatever parts you are able.
So breakfast was at what time?
It starts being served at 7:15 though till 8 in the theater.
Is that right?
Yep, 7:15 to 8 is breakfast, then 8 o'clock we move into the theater.
Okay. Anything else?
I went to the PTO.
Oh, did you?
Last week Thursday. Last week Thursday.
Is that right? Thursday. A small but highly motivated group. Yep. So they're kind of in a rebuilding year, they've said, and yeah, some great ideas. They're going to do some fundraising, and I stepped out to football practice Wednesday. It's all kind of blurry now, and I had not met Jeremiah before, and met some of their staff and watched a little bit of practice, and I will say it is way different than the way we practice football, and I think it's a lot better. So
And hopefully safer.
yep, yeah, it has to be safer.
Okay, and everyone has on their agenda for our tour at 5:30 on Thursday meet at Red Creek. Okay, any other future agenda items? That's it.
Are you gonna do number 5 again, public comment, that had nothing to do with COVID? Because I don't believe that was mentioned. We did
Public comment can be about any subject. It doesn't have to.
We did it specifically for COVID when we started the public comment.
Okay.
Tonight?
Yeah.
But everybody was signed
No.
up and they
For
could.
that, but I also had public comment that had nothing to do with COVID, so we're talking about COVID during that time.
You could sign up for anything you want.
Yeah, Marty informed me that everything that was signed up for was COVID or vaccine related, and that's why I invited Dr. Severson to go ahead, because everything had stated that was the subject only.
Correct. And then I also had signed up for a comment that was not on the agenda.
And
You only signed up once. You have
You-
4 minutes. Each
Right,
person
but I
has 4
asked
minutes.
you when I signed up, do I just check both? I had public comment for something on the agenda and one for not on the agenda.
You could have your 4 minutes and say whatever you wanted. It didn't have to be. You could have you could have talked about whatever you wanted
Do you
to.
think it would have been appropriate because everybody was focused on COVID then? Because if that's the
Yeah,
case,
it's, public
then
comment is an
you're gonna
open
hear a
time.
lot. But we started public comment with agenda item 6.2.
No, well,
So
no.
could we solve this by, is
Okay.
the board willing to listen to Betsy's second public comment now for 4 minutes? Are we willing to listen to that? Or could we just go there?
Yeah.
Get it out.
That's for a minute.
Yeah, we're fine. But please note, you know, you can talk about anything. It doesn't have to be a
I think that
subject.
should be clarified for the next time, because when you start a public comment based on 6.2, after Dr. Severson gave her report,
Normally
then.
there's
No.
no present,
Yeah,
normally there's
yeah.
no presentation before public
Right.
comment, so I
Yeah,
understand what you're
okay,
saying.
okay.
Okay.
Okay, Betsy, it's, floor is yours.
Please, because
Yeah.
then it's on the recording.
Yeah, because-
Please, you have to use the microphone,
Yeah.
otherwise it won't be on the
It
recording.
doesn't,
You
it
do
doesn't
have to.
get filmed, yeah.
I know you guys love me. One thing I would like the board to write down, 2 policies, 840 and 655 need to be reviewed by the board. I'm all for making things more convenient just for students, but one thing that was brought up tonight at the end here was about the athletic physicals in our community. There's 3 facilities, 2 are for nonprofit, 2 are for profit, 1 is for nonprofit. And they all meet the requirement to do a WIA physical. The school decided to bring in 2 doctors tonight and tomorrow night, as we were well told, and they would choose to promote it. We used the school email, there was phone calls using the school resources and utility costs, and under promoting these physicals for a place that's for hire. So if you look under board policy 840 and 655, that should have been brought to the board. There should have been outside businesses that do it too, to give recommendations on what their lowest bid is, and it should have been voted on. So I'm all for playing by the rules. I'm all for giving students as much access to different things as possible. But I just wanted to bring that up. If you look at policy 840 and 655, the updates for 2021 are not on the website yet. These are based off of 2020. So that's it.
Okay, thank you. Okay, are we, any other future agenda items? Okay, is there a motion to adjourn?
Oh, I just have a comment. It was the woman who brought up her child who had the vision troubles and what she was talking about. I found that really concerning.
So, absolutely have made an awful lot of accommodations, and we can certainly, I'll get some information because it's very individual identifying. I'm not sure it's for public conversation right now.
Yeah.
I will just share that, remember during the shutdown last year when we did have to send everybody home, we still invited all of our special education kids in physically and bused them and transported them, and some parents said no thank you. So I just wanted to remind the board that we went well beyond what the requirements were, and not all families were open to that last year, but I will certainly get you some information on that.
And I fully recognize that there's what the parent shares and there's
Absolutely.
always a fuller picture.
But it's perfect to ask for more information, absolutely. Yep, happy to provide.
Okay,
Do we have a motion to adjourn?
no, we did not.
I'll make that motion.
Okay, and is there a second?
Second.
Okay. All in favor say aye. Aye, opposed. Okay, we are adjourned at 8:28. Thank you, everyone.
It's a little surprising considering the depth of the conversation was